I have a couple more questions. Can you explain the pricing model for just regular care in a joint franchise?
Yes. Briefly, a chiropractic adjustment, an office visit, is $29 nationwide. If you're a new patient coming in for the first time, you'll get your exam, your history, your exam, your diagnosis, and everything, plus your first adjustment for the introductory fee of $19. We're trying to remove the barriers so that patients can access care that's affordable. In fact, 20% of our new patients, of the joints new patients, are new to chiropractic. So we're attracting people that hadn't considered chiropractic before.
It kind of makes me wonder with those prices are very reasonable and pretty low. Can the joint pay its doctors a decent salary with prices that low?
Yes, we can, and I wanted to amplify on what I was just talking about. The joint also has group purchases, so monthly fees of $49. You can get 4 adjustments per month. So it's actually less than what I was just talking about for a regular maintenance patient. In regard to paying fees and paying salaries, yes, the joint is very competitive. In fact, I imagine we pay more than what most associate positions pay within chiropractic. It's not uncommon for a starting doctor in the joint system will make $60,000, and we have many doctors. A number of doctors, I'm not going to say the exact number, that are making 6 figures.
Wow. What about quality of care? In a high-volume practice, does that quality of care suffer, or is everybody getting treated as they should be?
Absolutely. There are no options when it comes to the quality of care. You have to have quality of care. Because if you don't have quality of care, if you don't do what you're supposed to do, if you don't do a history, if you don't do an exam, if you don't do a diagnosis, then the doctor's in danger of losing their license or being disciplined. There is no option but to follow the standard of care. And as the Chief Chiropractic and Compliance Officer, that's my responsibility, to make sure our doctors have the tools to always meet the standard of care of a reasonably prudent practitioner, and I am dedicated to that.